of all people who are actually at risk of a heart attack. Half, 45%. That means if you and your friend both go to the doctor today and you both get told your heart is fine, statistically, one of you may already have dangerous silent plaque building up in your arteries, and your doctor has absolutely no idea. And as a doctor myself, I find that deeply concerning because the signs are there. They're just not the signs you've been told to watch for. I'm Dr. Sam Aric, and in the next 20 minutes, I'm going to show you the 7 warning signs that your heart is in danger, signs that most doctors completely miss in seniors over 60. I'm also going to show you exactly which blood tests you need to ask for, what foods are silently accelerating your risk, and what you can do starting today to protect your heart. Stay until sign number 5, because that one catches almost every senior off guard, and it may save your life. Now, before I get into the warning signs, I need to explain something that most doctors don't take the time to tell their senior patients. Heart disease does not work the same way in a 65-year-old as it does in a 45-year-old. After the age of 60, 3 major changes happen in your cardiovascular system that dramatically increase your risk and make heart attacks harder to detect. Asterisk. Change number 1. Your arteries become stiffer. With age, the walls of your arteries lose their elasticity. This is called arteriosclerosis. Stiff arteries mean your heart has to work harder to pump blood, which strains the heart muscle over time. And because this happens slowly over years, you may feel completely normal while the damage quietly accumulates. Asterisk. Change number 2. Your pain signals weaken. This is critical. As we age, our nervous system's ability to transmit pain signals can become less sensitive. This means that when heart tissue is starved of oxygen, which is what happens during a heart attack, you may feel almost nothing, or just mild discomfort that feels like indigestion or a pulled muscle. This is called a silent myocardial infarction. Up to 25% of all heart attacks are silent, and they are far more common in seniors. Asterisk. Change number 3. Your warning symptoms change. Asterisk. Classic heart attack symptoms, crushing chest pain, left arm pain, are textbook signs designed around how younger adults experience cardiac events. Seniors, and especially women over 60, often experience completely different symptoms that get dismissed, symptoms that get misdiagnosed, symptoms I'm about to show you right now. This is why so many seniors have heart attacks without warning, because they were looking for the wrong signs. The first warning sign, and one of the most commonly dismissed, is unusual fatigue. Now, I'm not talking about being a little tired after a long day. I'm talking about a deep, heavy exhaustion that does not get better with rest. You wake up after 8 hours of sleep and still feel completely drained. Tasks that used to be easy, getting dressed, walking to the kitchen, climbing one flight of stairs, suddenly feel overwhelming. Why does this happen? When your heart is struggling, when the arteries supplying it with blood are narrowing due to plaque buildup, your heart has to work harder and harder with less oxygen. That chronic strain translates directly into whole body fatigue. Your muscles aren't getting enough oxygen-rich blood, so everything feels harder. Many seniors and many doctors write this off as just normal aging. It is not normal. Profound, persistent fatigue that is new for you is a red flag. A 2026 study on silent heart attacks specifically identified unusual fatigue as one of the top presenting symptoms in older adults, particularly in women. In fact, women over 60 are significantly more likely to have fatigue as their primary heart attack symptom than chest pain. If you or someone you love has been unusually exhausted for weeks with no clear explanation, please do not ignore it. Get your heart checked. Sign number 2 is shortness of breath, but not the kind you'd expect. This isn't about running a marathon. I'm talking about getting winded walking to your mailbox, feeling breathless when you climb a single flight of stairs, noticing that activities that never bothered you 6 months ago now leave you gasping. When your heart isn't pumping efficiently, blood backs up in the pulmonary vessels, the blood vessels in your lungs. This causes mild fluid buildup that makes breathing harder. And again, because it develops gradually, it's easy to dismiss as just getting older or being out of shape. Here's what I want you to test at home right now. Think about what you could do 1 year ago that feels harder today. If you notice a clear decline in your physical stamina, especially if it happened over weeks or months, not years, that is worth investigating immediately. This symptom, combined with fatigue, is one of the strongest combinations that signals early heart failure or coronary artery disease in seniors. Sign number 3, and this one surprises almost everyone I tell it to. Jaw pain, neck discomfort, upper backache, not chest pain. Jaw pain. During a cardiac event, the vagus nerve, which connects your heart to your brain, can refer pain signals to unexpected areas of the body. Your jaw, your neck, your upper back, even your teeth. Some people describe it as feeling like a bad toothache. Others say their neck felt tight or their upper back ached for hours before anything else happened. Because there's no chest pain involved, people think it must be dental. It must be a stiff neck from sleeping wrong. It must be muscle tension. And they wait, and they wait. The Cleveland Clinic and American Heart Association both confirm this. Pain or discomfort in the jaw, neck, shoulder, or upper back without obvious cause, especially when accompanied by mild fatigue or nausea, should be treated as a potential cardiac warning sign until proven otherwise. If you experience unexplained jaw tightness or neck pain that comes and goes, especially during mild physical activity or emotional stress, please tell your doctor and specifically ask them to evaluate your heart. Sign number 4, digestive symptoms. This is perhaps the most dangerously overlooked warning sign because it feels exactly like heartburn, acid reflux, or a stomach bug, nausea, a feeling of fullness or pressure in the upper abdomen, indigestion that doesn't respond to antacids, general queasiness, sometimes vomiting. During a heart attack, especially in seniors, reduced blood flow to the heart can trigger the vagus nerve in a way that mimics gastrointestinal distress. Your body is sending pain signals, but they're being rerouted to your stomach instead of your chest. Baptist Health Medical Center reports that patients who survive silent heart attacks often recall thinking they had an upset stomach, food poisoning, or a bad case of the flu. They took antacids. They lay down. They waited for it to pass. Here's the rule I tell all my patients. If you experience nausea or upper abdominal discomfort, and you also have any of the other signs on this list, unusual fatigue, shortness of breath, jaw pain, do not assume it's your stomach. Call for help immediately. The combination is the clue. This is the one I told you about at the beginning. Sign number 5, cold sweats. Breaking out in a cold, clammy sweat when you haven't been exercising, when you aren't hot, when there's no obvious reason, when your heart is in distress and your body is not getting adequate blood flow, your nervous system activates a stress response. It triggers sweat glands, especially on the forehead, palms, and upper lip. Cold sweats, not hot ones. You may feel chilled at the same time. It often comes with a sense of dread or unease that is hard to describe. Patients often say they felt like something was very wrong, even though they couldn't explain why. This symptom is particularly significant when it appears suddenly during rest, not during exercise. If you wake up in the middle of the night drenched in cold sweat with no fever and no obvious cause, especially if you've been feeling unusually tired or short of breath recently, take that seriously. Combine cold sweats with any 2 other signs on this list. Call 911. Do not drive yourself to the hospital. Do not wait for it to pass. Sign number 6 is dizziness or lightheadedness, but again, in a specific pattern. A brief spell of dizziness when you stand up too quickly is common and usually not serious. That is orthostatic hypotension, a drop in blood pressure when you change position. But what I'm talking about here is dizziness that hits you during normal activity or even at rest. A sudden feeling that the room is spinning, a sense that you might faint. Lightheadedness that comes on without obvious cause and lasts for more than a few minutes. When your heart is struggling to pump sufficient blood, your brain can receive reduced oxygen, and that registers as dizziness. This symptom is especially concerning when it occurs alongside shortness of breath or chest discomfort. Senior women in particular are more likely to present with dizziness and fainting as heart attack symptoms than the classic male presentation of chest-crushing pain. This difference in presentation is part of why women historically had worse outcomes. Their symptoms were dismissed or misattributed to anxiety, dehydration, or low blood pressure. If you experience sudden, unexplained dizziness, especially if it's new for you, please have your heart evaluated. And sign number 7, swollen ankles or feet. When the heart is weakening and cannot pump efficiently, fluid begins to accumulate in the lower extremities, your ankles, feet, and lower legs. This is called peripheral edema, and it's one of the hallmark signs of early heart failure in seniors. Now, some ankle swelling is normal after a long day of standing in hot weather or due to certain medications, but here's how to tell the difference. Press your finger firmly into the swollen area for 5 seconds, then release. If the indentation from your finger stays visible for several seconds, that is called pitting edema, and it suggests fluid retention that warrants medical evaluation. Swelling that is worse in the morning, that gets better when you elevate your legs, or that has been progressively worsening over weeks, combined with any of the other signs we've discussed, is a serious warning signal. This is one sign that's actually visible and testable at home right now. Check your ankles tonight. Now that you know the 7 signs, let's talk about what to actually do, because awareness alone is not enough. The next time you see your doctor, I want you to specifically ask for these tests, not just the standard cholesterol panel, these tests. Asterisk, test number 1, HSCRP, high sensitivity C-reactive protein. This measures inflammation in your body. Chronic low-grade inflammation is one of the strongest predictors of heart attack risk, and it is not included in a standard blood panel. You have to ask for it specifically. A level above 3.0 mg/L is considered high risk. Asterisk, test number 2, LPA, lipoprotein A. Asterisk. This is a genetic risk factor for heart disease that up to 20% of the population carries, and it does not respond to diet or statin medication. Most doctors never test for it. You can have perfect cholesterol numbers and dangerously elevated LPA at the same time. Ask your doctor, have you ever tested my LPA? Asterisk. Test number 3, CAC score, coronary artery calcium scan. This is a low-dose CT scan that actually images the plaque inside your coronary arteries. Remember that Mount Sinai study I mentioned at the beginning? That current screening tools miss 45% of at-risk patients. Their recommendation was exactly this: shift focus from risk scores to imaging the plaque itself. A CAC score of 0 is highly reassuring. A score above 100 means you need aggressive intervention now. Write these 3 down. Bring them to your next appointment. Your heart may depend on it. Now, what you eat matters enormously, and there are 3 foods that seniors specifically need to limit or eliminate. Asterisk. Food. 1. Processed deli meats and cured meats, salami, bologna, hot dogs, packaged ham. These are loaded with sodium and nitrates, both of which contribute to arterial stiffness and elevated blood pressure. A 2025 Harvard analysis linked high-processed meat intake to a 42% higher risk of heart disease. For seniors over 60 whose arteries are already losing elasticity, this is particularly dangerous. Asterisk. Food. 2. Sugary drinks, including fruit juice. Asterisk. Most seniors know to avoid soda, but fruit juice is equally problematic. A glass of orange juice can spike your blood sugar just as fast as a can of Coca-Cola. Blood sugar spikes trigger insulin release, and chronically elevated insulin is directly linked to arterial inflammation and plaque formation. Eat the whole fruit. Skip the juice. Asterisk. Food 3. Refined white bread, white rice, and pastries. These refined carbohydrates convert to sugar almost immediately in your bloodstream. For seniors with even mild insulin resistance, which is extremely common after 60, every serving of white bread or white rice is essentially a sugar hit. Over time, this accelerates the very plaque buildup that causes heart attacks. Replace these with fatty fish like salmon twice a week, a handful of walnuts daily, leafy greens, olive oil, and berries. These are foods with decades of cardiovascular evidence behind them. So let me give you 3 things you can do starting today. Asterisk. Action step 1. Do the ankle test tonight. Press your finger into your ankle for 5 seconds. If the indent stays, schedule a doctor's appointment this week. Asterisk. Action step 2. Write down your symptoms for the last 30 days. Unusual fatigue, shortness of breath on stairs, jaw tightness, digestive discomfort with no cause. Bring that list to your doctor. Doctors respond to documented patterns, not vague feelings. Asterisk. Action step 3. Ask for the 3 tests: HSCRP, LPA, and a CAC scan. These 3 tests together give a far more complete picture of your actual heart attack risk than any standard blood panel. You are your own best advocate. Ask for them by name. Your heart has been working every single second of every day for your entire life. It deserves more than a 10-minute annual checkup. If today's video helped you see something you hadn't noticed before, please share it with a parent, a spouse, a friend over 60. You might quite literally be saving their life. If you have questions about any of the signs we discussed today, leave a comment below. I read every single one. And if you want to know more about the blood tests, the foods, or how to talk to your doctor about heart disease prevention, I have more videos coming that go even deeper. Click subscribe so you don't miss them. Take care of your heart, because nobody else will do it for you. I'll see you in the next one.